Hi, good morning. I'm Dr. Zoe McMillen with Lifescape. Thanks for joining us for this Facebook Live. We're going to be focusing on urinary incontinence as the topic today. I'm going to briefly, though, touch on some COVID points at this time. So especially now with everybody planning on gathering for Thanksgiving, we all, of course, want to be safe, but also see our families and enjoy. Definitely I can say I think everyone in healthcare is very thankful for the vaccines that have allowed people to be able to maybe get together a little more safer, and that have prevented a lot of unnecessary deaths at this time, and have helped also prevent serious complications. So definitely thankful also for our health, that's a critical component. And if you do get COVID, you want to try be as healthy as possible if you are unfortunate enough to get it. That being said, vaccination is not bulletproof. We are seeing here at Lifescape some patients who are vaccinated still get COVID. It is usually a more mild course. You don't end up in the hospital usually, and so a lot different to the pre-vaccination times. That being said, the boosters do seem to be helpful. So I would encourage everybody who's 6 months out from having got their last shot to get a booster. The FDA is finally going to get on board with that, giving boosters to everybody, or at least all adults later today. So that's been something right now. They've limited the boosters. We're seeing with the research, your antibodies do decline after that 5-6 month mark. So it makes sense to get boosted. So please do. It definitely improves your chances of not actually getting COVID, and it's still not a nice disease if you do get it, so recommend it. Cases are rising in many places across the country. We here in Arizona, we're following a trend of, it looks like things are maybe rising a little bit. We are at a 12% positivity rate for testing, so that means 12% of people who are just getting their nose swabbed because they have some sort of symptoms are positive, which is considered a high positivity rate. And the hospitals are very busy, both with COVID and non-COVID conditions. So want to limit the number of people who have to go there, because that could be overwhelming to the system. Anybody who got the J&J vaccine should get vaccinated again, or get boosted. So you got that one J&J shot, get something else. Ideally, I would recommend an mRNA vaccine at that time to really get good coverage and better protection. So one of the Pfizer or Moderna. It's also okay to mix and match. So if you got a Pfizer series, you can get a booster with Moderna. So that's okay to mix and match. So with the FDA likely to finally approve boosters for everybody, pharmacies should be opening it up, making it much easier for everybody to get that booster done. Some other things, if you want to have a really safe Thanksgiving, if it's going to be a pretty big crowd, your family's big, that happens to be with mine, host outdoors if you can. We do live in beautiful Arizona. Take advantage of that and try and limit the indoor exposure. If people are indoors, mask. You can be extra safe and test, especially if there's somebody who's going to is considered a high risk. If you have a high risk family member, it's probably a good idea for everybody to test. They have the Binax at home kits readily available at the pharmacy. Get some of those. Everybody tests. It's not a guarantee. There are, of course, false negatives with that. If you test just a little too early, etc., it's not a guarantee, but it's maybe one other layer of protection. Hand hygiene, of course, and if you're sick, unfortunately, isolate, because if that test's negative, it's not a guarantee. All right. And then moving in today's topic a little more about urinary incontinence. This is a relatively common issue, but people don't really like to talk about it. Understandably, people sometimes feel embarrassed. And urinary incontinence can include everything from a little bit of leakage when you don't want it to a lot of urine, just you can't hold it. And you may have heard a lot of ladies often say, oh, after having kids, now when I laugh or I sneeze, a little bit leaks out. And it is, more common in women because of that reason that women are, pregnant, having childbirth, going through menopause, but it can happen to men too. And it isn't a normal part of aging, so don't just to say, oh, well, this is normal and I'll need to deal with it. If, there are things that can be done, and it is a distressing part of life, so let's do something to help. There are 4 main kinds of urinary incontinence. Overflow incontinence, that's maybe where you're getting, your bladder is getting too large with urine. You're not maybe sensing that you have a lot of urine in your bladder and you then leaking because it's too full. Stress incontinence, where that's the sneeze, cough, laughing, anything that's putting a little pressure in the pelvic area is then causing some leakage. Overactive bladder, where you feel that sensation of I gotta go more often than you feel you should. So every, you go every hour or two, that's overactive bladder most likely. And the most common for women is stress incontinence, then overactive bladder, and for men it's overflow incontinence. Some symptoms you may have for any of these could be an uncontrollable urge to urinate, a little leakage when you're exercising, sneezing, frequent urination, constant dribbling, feel like you can't empty your bladder, like you go but you're not emptying properly, or you're waking up many times at night to urinate, or even if you're having an accident during sleep. So all of those things could be something we need to look at and could be helped. Risk factors, the older we get, the higher risk of having this. Being obese is also a risk factor. More children you have, the higher your risk. Potentially the mode of delivery, so potentially a vaginal birth, especially if there's some damage to the pelvic floor musculature, that could play a role. Some medical conditions can also, such as diabetes, and alcohol, smoking, caffeine intake can play a role. The treatment, though, really depends on what the cause is. So that's where, talking with your doctor is going to be important, so to figure out where you are in the spectrum. Even just looking at your medication list, there are some that can worsen this. Even over-the-counter antihistamines can be something playing a role, or antidepressants, and how common are all of those medications. Lifestyle modifications may be an appropriate first step, depending on the type of incontinence, as well as pelvic floor muscle exercises. I'll bring up that we are fortunate enough to have McMillen, which is now a great way of kind of doing those pelvic floor exercises. It's like pelvic floor exercises on steroids and without you having to do very much. So I'll get into that a little bit. But for now, some of those lifestyle modifications are weight loss, decreasing alcoholic beverages or caffeinated or carbonated beverages, and definitely avoiding constipation. We do have options for medications, especially if women, it seems to be more related to postmenopausal issues. Then topical vaginal estrogen can definitely be helpful. And there aren't any medications to help with overactive bladder. If you just, have to go every hour, there are things to help decrease that sensation. Of course, last resort is surgery, and that's only for certain types of incontinence. There are also some injectables like Botox and things that can be used depending on the type of incontinence. But getting back to the Emsella, it's really easy to use. You can come in fully clothed, sit on a chair, you can read a book while you're having this treatment. It uses electromagnetic energy and it's delivering thousands of supramaximal pelvic floor muscle contractions. Each treatment lasts 30 minutes. No pain or anything like that. You need about 2 sessions a week for 3 weeks for maximal benefit. The long-term effect, the effects only take place in the long term, so you're not going to immediately after treatment notice an improvement. It does take a month or two. Think of it as the muscles are getting worked, they need to build up, get stronger. But a lot of people really have noticed a difference with this. So talk to us if you need to do those pelvic floor exercises. This is a great way of getting that done. So in general, don't be embarrassed about this. It's a pretty common issue. People have it on a scale of very, very mild to sometimes severe, but there's a lot that can be done. So bring it up to your doctor or provider if you are having these issues. But in closing, I just want to wish everybody a very happy Thanksgiving. We're so thankful to have such amazing patients. We're very lucky to have a great staff here at Lifescape. And everybody, I hope you have a safe Thanksgiving and an enjoyable one. Hopefully you do get to now see family this year. All right. Thank you. Bye.